Okay, I want to welcome you to our webinar, Disaster Response, Reaching Those Left Behind. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the people who lived and continue to live in this country and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the fourth in our 2022 Climate Justice webinar series as part of the Climate and Health Equity Fellowship Program. The Chef Fellowship is a program that recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I'm Dr. Venice Curry, the Western Associate Director of the Climate and Health Equity Fellowship Program. Also joining me from the consortium to run this webinar are Program Manager Jordan Curry Carter and our Program Assistant Clarissa Payton. They will both be available through the chat to answer any technical questions during the webinar. Our other team members on the webinar are Program Director Dr. Mark Mitchell and our Program Manager Dr. Kimberly Williams. The webinar series is hosted by the Medical Society Consortium on Climate and Health and is held for 1 hour on the second Friday of each month from 3 p.m. to 4 p.m. Eastern Standard Time. Today's webinar will be recorded and made available on our website for future viewing as part of the Equity Resources page on the consortium's website. Today, we are honored to have Dr. Armen Henderson, a 2021 Chef Fellow and Assistant Professor of Medicine at the University of Miami and an internal medicine physician, and also Moriah A. Washington, Director, Community Engagement at New York City Emergency Management Department. Rather than use our time to provide further description of their impressive work, we are placing a link to their bios in the chat. As a healthcare provider, it is important to consider the role that healthcare systems and providers play in regard to climate and health. In this webinar, Dr. Armen Henderson will talk about the effects that disasters, such as extreme weather events, have on disadvantaged communities, and his program to engage health professionals in responding. Moriah Washington, the Director of Community Engagement at New York City Emergency Management, will report on culturally specific solutions to emergency response that the department makes available to their residents. The general format for today's webinar will be 2 20-minute presentations by our speakers, followed by 10 minutes of questions and answers from our audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for the presenters in the chat box during the presentation at any time, and we will get to as many questions as we can during the Q&A. Please keep yourself muted so that we are not interrupted by any background noise. And Dr. Henderson, you may begin.
Okay, thank you so much for the introduction. Welcome, everybody. Looking forward to the conversation. Okay, so today I'm going to be talking about climate change and health, but in particular, how disasters affect some of the patients that we serve in poor and low-income communities, and what we're doing about it here in Miami, the Miami community, in responding to people, not just in Miami, but throughout the state of Florida, and throughout the country and in other countries as well. So with that said, I have no financial disclosures. I don't make any money on any of this. So I'm going to skip through to a bunch of slides because I think you all are going to get a lot of this information if you have not already gotten it But I want to refocus some of our attention to the social determinants of health, which I'm sure you've heard about them as well. Conditions and environments in which people are born, live, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. And the fact of the matter is that climate change exacerbates all of them. So climate change is a threat multiplier, specifically disasters, but also climate change too. So these are just some of the social determinants of health. As you can see, all of these things I like to point to the fact that they are all controlled by local politics, basically, on a state level, but sometimes more so even on a local level. Let's get through a little more to the fact of the matter is that climate change is also disasters, and disasters have been very, very deadly, not just in the United States, but all across the world. And they're also very expensive too, specifically in the United States. These were the weather events in 2020, and the amount of money that we've spent kind of correcting or trying to respond to these weather events were all in the billions of dollars. So it's very expensive. And so I'm going to bring it back a little more local to what we were doing and how it affected us in Miami. So I moved to Miami from Nashville, Tennessee, which is where I did medical school at Meharry Medical College. And while I was in residency, we had a hurricane that was slated to hit or to touch down in Miami. I believe it was in 2017. Hurricane Irma came, and I heard about hurricanes before. I had responded to crisis situations in other countries, and so I said, you know what, I'm prepared. We live in the United States. Everything will be fine. And what happened was that the hurricane barely brushed our coast, but we still had a lot of lasting effects from the tropical winds. There were a lot of power outages, a lot of trees that were down, but also, businesses closed and things of that nature. And while I was watching TV, actually I was locked down in a hospital, but as I was watching TV locked down in a hospital, what I saw was that that our local government had everything under control, and that FEMA was coming, that the American Red Cross was coming, and things of that nature. And I was like, great, we have everything under control. And then I got a call from one of my colleagues who you see in the red shirt. Her name is Valencia Gunder. She does a lot of work around climate change and environmental justice throughout the country, but she lives in Miami. And she runs a local organization called the Smile Trust. They respond to unsheltered people and feeding and clothing and things of that nature. And so I got a call saying that, this was directly after the hurricane, maybe like a day or two afterwards, that the reports that we were hearing on TV were completely different than the reports that we're hearing on the ground. And that she said, look, I'm going to just get a grill, and I'm going to ask for donations for food, and we're just going to go right around and feed people. And so that turned into feeding 30,000 households throughout the county, or 30,000 individuals throughout the county in multiple places. And it also resulted in us starting what we call the Community Emergency Operations Center. So basically, while she was feeding individuals, I got together with some of my friends in the hospital who are also doctors or medical professionals, and we were checking on individuals who were stuck in the house, particularly those that were elderly, but also those that were on, medically saving devices that weren't working and things of that nature. We were transporting people to the hospital. And what we found was that in most areas, specifically those that were Black and low income, which is the areas that we work in, Opelika, Miami Gardens, Liberty City, all the zip codes that have the lowest life expectancy throughout the county, was that the Red Cross wasn't getting there, the food wasn't getting there, the water was not getting there, the help from FEMA and from Red Cross was not getting there. And people were suffering because of that. And so, it was good that we were there, that we were helping, to respond to individuals. But the fact of the matter is that we were not as prepared as we should have been, on a community level, but also on a local level from our government. And we just felt that something like this should not happen in a place where we spend so much money on, specifically on disaster relief, and in a place where we experience hurricanes every year. You would think that our local government, our communities would be more prepared, but they were not. Um, so fast forward a year or so later, this organization called Radical Partners did a survey of people in the community, thousands of people in the community, around radical ideas that they wanted to bring to fruition in the Miami-Dade community. And one of the top ideas that they had was that people were asking for a medical disaster response team locally to help bring climate resiliency and sustainability to those that were suffering medically, particularly during like hurricanes and other disaster situations. And so, we were already doing, my organization, Dade County Street Response, was already doing things around gun violence, which is also a crisis as well. And after, people saw the work that we were doing after during Hurricane Irma, they encouraged us to apply for this fellowship or this grant. And so through that, we started the Dade County Street Response Disaster Relief Team. This is our logo, and we've been going strong ever since. And so basically what we do is we focus on the things that people are more likely to die from during disaster. And we try to create, we created a hurricane healthy toolkit. So this is the first one of our projects. Because we have people who speak Spanish and Creole and English, we had to put it in 3 different languages. But our first mission was to get out into community before disaster strike and to hand out information around the things that they're going to be affected by should another disaster strike up. And so then we started to actually operationalize. And so I want to go back. We actually did not only just feed people and just check on individuals, wellness checks of those behind who were stuck in their house with medical devices that were not working. We actually set up shelters all up and down Miami-Dade County. And here's a Google map of where those shelters are located. And so these are places in which people are targeted with the lowest life expectancy. We make like little community hubs where people can go, can seek shelter, could get access to food, and other things that they may need after a disaster, but just to help them be more prepared and to create a place where individuals can go and get the things that they need. And then to have medical physicians, medical doctors, medical professionals there at that time of need as well. And so, one of the things that I like to summarize is that in times of disaster, it makes everything worse. Miami is especially susceptible, and what happened in Irma, in Puerto Rico, and Houston, in New Orleans, it could happen, and it will happen. It has happened again and again, over and over again. So the Community Emergency Operations Center, our onus is on focusing on making sure that the community is ready in times of disaster, whatever the disaster may be. I know you're saying, we don't really get, hurricanes in Houston, but they have flooding. In Texas, they had a deep freeze that flooded all the pipe that froze all the pipes, and then you had flooding, and you get the same remnants of disaster that happen. Even if there's not a hurricane, you still get similar disasters in which poor and low income people suffer as well. So I have this thing where, we speak directly to community, we speak directly to anchor organizations, but we also speak directly to physicians as well. And these are just some things that I tell physicians about how to have conversations with their patients, but that's not really what I'm focused on. What I was really focused on is the deliverable that I made as a Climate and Health Equity Fellow last year, which was really focusing on operationalizing our community emergency operations system, and in particular, the disaster relief team, which is one part of the Community Emergency Operations Center, which I'll talk about right now in the Medical Professional's Guide to Disaster Relief. So I sent you all this link, and feel free to use it, to share it, to copy the ideas. That's what I'd like to do. Originally, I was thinking maybe I publish it and try to make money off of it, but I think it's an important tool that not only I think you should have access to, but it's something we're also presenting to individuals during the COP27 conference in Egypt this year as well, because it applies not just to communities in the United States, but also to communities who are suffering climate disasters and emergencies across the world as well. So basically, in the introduction, I talk about how Hurricane Katrina was just the worst disaster that we've ever seen happen on live television in the United States. And it happened amongst poor and low income and Black individuals. And during that time, Kanye West proclaimed famously that George Bush doesn't care about Black people. And everyone was up in arms about that. But when I really started to examine, like, what was he really saying? It's that the government does not know how to respond to poor and low income, particularly Black people during disaster. And since Hurricane Katrina, we've seen the same thing play out over and over again in Miami, as I said, in Houston, in Puerto Rico, which is where I have President Trump throwing some paper towels into the crowd. They don't take it seriously. They don't know how to respond to these communities. And so there's a need to start a disaster relief team, a medical related disaster relief team, since we all are medical professionals, because hospital systems and other medical organizations also do a horrible job at responding to communities in crisis as well. And so one of the things I didn't mention, I'm an assistant professor at the University of Miami. I think we have the second or third largest hospital system in the United States, behind Houston, Texas, and another one, I forget exactly which one it is. And when we had a hurricane, our hospital system closed the door to the communities directly that are adjacent to the communities that we normally serve, and they focused more so on their staff and the people that were already in the hospital in terms of being safe. But what you'll see in this guide is that I think anchor organizations should do a better job of reaching out and making sure that, at the very least, the communities that are adjacent to the campuses should be well taken care of. Because normally, a lot of the hospitals, especially the ones that do the most care in the United States, are in poor and low income neighborhoods already. So what is their role in terms of an anchor institution, in terms of a medical organization in responding to communities during disaster? And I kind of start to dig into that. But one of the reasons why I started a disaster medical relief team, and why you should think about it as well, is because people need education about the effects of climate change on health, which is why you're in this fellowship. Great job. But we also need to decrease the utilization of inpatient services during crisis triage. When the hospital that I worked in closed the doors, there were literally lines of people waiting outside of the doors while the hurricane was raging to try to get in. And it was sad that they felt like that this was the only place that they could seek refuge. There's also advocacy needed for change in the public and health policy. And education needs to be had amongst vulnerable populations about preventable deaths during disaster. And then we also need equitable resource allocations of hospitals and medical anchor organizations located in vulnerable communities. So on TV, when Hurricane Irma was going on, the Red Cross was saying, oh, we have all these things going on and we're handing out all this stuff. And what was really happening was that they were focusing on already well-to-do communities. Communities that had the highest life expectancy and the highest income were those to get their electricity on first, and things of that nature. They were also the first to get some of the resources that people like Red Cross was giving out, and things of that nature. And so I think we need a reverse. I think we need to focus more on vulnerable communities than we do more well-to-do communities, because the low-income communities are already at a disadvantage. And so I talk about some things like what is required. You need relationship building through mutual benefit. So the most important part about starting a disaster medical relief team is building relationships in the community. You can't just show up and say, hey, we're doctors, we're going to do these things in the community, we're going to respond to you during the community, because more than likely they're not going to trust you. And so, I really talk about how Dade County Street Response has embedded itself, not just during disaster, but throughout the year, in services that continue to run during disasters as well. So we train medical professionals within Dade County Street Response to be to be organizers, to knock on doors, to step outside of the hospital and into the community, introduce themselves outside of their normal, business attire, to say that, hey, we're here for you. We have services that that you can benefit from, and how can we help you? And so the Dade County Street Response, for example, has a street medicine team which does weekly wellness checks and serves as case managers for unsheltered population in Miami. We do Stop the Bleed and CPR workshops for people experience the most gun violence. We have an alternative to 911 mobile crisis line that will continue to run during disasters as well, in which people can call us instead of calling the police. We're starting a sobering center this summer for those who have drug addiction or problems with alcoholism, and in people who do not want to call the police and have their loved ones shipped off to jail or put in the hospital. They can come to the sobering center, but this will also dub as a cooling center as well. And then we also have a free urgent care that's open throughout the year, and it serves as a field clinic in disaster as well. And so it's unlikely that each medical professional or on this call is going to do all those things, but you can do one thing. You can work in the organization and encourage them to continue services or to figure out some sort of plan to continue to reach populations during disaster, which I all think is very important. The other thing I think is important is identifying existing local and non-local emergency resources. There are so many things that the county, that the city, that the state offers, particularly during disaster. But if people don't know about these things, then it doesn't matter. The city could be offering gold. If no one knows about it, no one's going to get the gold. And so we've really focused on what are those resources and how can we be credible messengers to the people in the community to make sure that they get those resources before, during, and after a disaster. So you really don't have to reinvent the wheel and think you got to spend all this money on new services, because in a lot of cases, the services already exist. And then establishing a strong volunteer base. How much time do I have?
Yeah, we are very, very close. So maybe if you can
sum it up. Okay, great. So yeah, I'm interested in taking questions and talking more with you about it. But basically, we use the same method to respond to vulnerable communities during every disaster, and we did it during COVID-19 as well. During the beginning, when people didn't know exactly what was going on, how it was going to affect us. And that work has really spread out nationally and internationally, in different spaces. But, if I had to sum up, my last, 30 seconds, I would say that our federal government, our local government, our state governments do not know how to respond to disasters, particularly amongst those that are poor and low income. They're still trying to get it right. And since Hurricane Katrina, the Federal Emergency Management System created a National Advisory Council that's supposed to report directly to FEMA and say, how can we make this right, and things of that nature. And they've done so ever since Hurricane Katrina, and yet we still have not gotten it right. And so I'm saying that we need to take it on the community level and take it into our own hands. So with that said, I can talk to you more about operationalizing that, and thank you for having me.
Thank you, Dr. Henderson, for that really enlightening and really thought-provoking presentation. We will have an opportunity for questions. So we will be able to ask questions about that presentation. So thank you.
Great.
Next, we will hear from Moriah Washington about culturally specific solutions. And Moriah, you may begin.
Thank you so much. So good afternoon, everyone. My name is Moriah Washington. I get to serve as a director of community engagement here at New York City Emergency Management. We are a locally based emergency management agency. When I say I get to serve, it is because it's truly a pleasure and it is a choice. So with New York City Emergency Management, just to give you like a very brief overview, we are helping to ensure that New Yorkers are able to prepare. We're doing the work to prepare, respond, and recover from emergencies. On the preparedness piece, we have a huge educational lens in which we go out to the community to provide individual preparedness, community preparedness, working with what are 3 steps you and your household can take, make a plan, gather supplies, get a go bag, and stay connected with our Notify NYC app. For community preparedness, we've established various different tiers. And so as part of our preparedness component, behind the scenes, there are hundreds of plans for any and every type of emergency that you can think of. There are also plans that are thrown out the window because of leadership, because of the type of emergency, shifts to different triggers that they anticipated as they establish the plans. And so for community engagement, we really get to get out there. So this morning I was able to be out in Coney Island with some young people, middle school and high schoolers, and they are doing something called resilience climate Resilient Schools for Climate. And it's a partnership between the wildlife, a couple of the different schools, and they're teaching climate change and climate justice with our young people. And they had the young people do presentations of their different projects. And as we were there, we were connecting them to like, hey, we got to prepare you in your household. So often the mark of impact of storms for New York City is Sandy. And so even though we're about to approach our 10-year mark, so many folks who have been impacted continue to reference that because of all the trauma around that. With that trauma, there were lots of gaps where we failed as a city. And so a plus that came out of that was that there were a lot of disability advocates who got together and they put together a big lawsuit and they beat the city, where they said, you didn't do anything to provide accessibility for us. You didn't help us evacuate. You didn't have evacuation centers that were accessible to people with disabilities. They gave a laundry list. They won. But the cool thing that came out of that is that we were then required to put DAFN specialists and DAFN folks throughout our agency and other agencies. So DAFN stands for Disabilities, Access, and Functional Needs. So not just the visible disabilities, but now we get to put that lump sum of older adults, younger children, individuals who English is not their first language. And it's being specific in how we do that outreach. And so for us, we work with disability organizations, we work with advocacy groups. They call, we come, but we also seek out. So we may go to a fair and we see a couple of other organizations that we haven't heard of or that we haven't been able to connect with. And we say, hey, who do you serve? What do you do? Oh, we would love to connect and present. When we come and present, if they say, hey, we need ASL interpretation, you got it. We provide that. We provide printouts of our personal emergency planning guides are in 13 languages, our 13 New York City languages. And so that includes English, Spanish, Haitian Creole, Chinese, simplified, Mandarin, Korean, Russian. And then it's just a list just continues to go on. And I say that to say, just as the advocates were able to push and say, hey, you failed this population and here's how you did, it rendered results where the city created and unlocked funding to say, we have to make sure this doesn't happen again. And so it's to the point where when I'm preparing and doing a presentation with an organization or a faith-based congregation around how to prioritize their services and have a continuity plan, I'm also thinking critically and making sure that I'm verbally communicating. You must think about your folks who have various languages. You must think about people with visible and non-visible disabilities. What are you doing to include and incorporate those components? And so how it gets to take a step further is that, yes, New York City is very diverse, very, very diverse. Yes, the communities who were able to bounce back with their resilience a little faster were folks who had a little bit more money in their pockets. But there are some strong and mighty advocates throughout the city. And so as Dr. Henderson was speaking, what came to mind is like what he's doing is something that we call a community organization active in disaster. So COAD, COAD. And so as part of my work in community preparedness, that's who we work with. We work with existing COADs. It may be networks who are already doing work around mothers against violence. We tap them on the shoulder and we say like, hey, you're in Hunts Point in the Bronx, right? Oh, what do you do? Housing advocacy? Okay. And anti-gun violence efforts? Okay. Well, it looks like you've been preparing the community or responding to this COVID-19. What does it look and feel like for you to take it a step further? And so I was able to birth a program called Strengthening Communities, where we are able to bring in some networks, hyperlocal groups who are doing the work on the ground. And we're saying like, we want to provide you with structured training, some technical assistance and coaching. And we want to take it a step further. We want to get what's in your mind onto paper so that when the next emergency happens, you're able to respond and your bounce back is even greater. And so we do a training, a coaching session, and then we compensate them for their work when they submit their deliverable. We've broken it down. We have an amazing toolkit. Our community emergency plan toolkit, which is our foundation. We do mapping and resource guide. We do how do you manage donations and volunteers? How do you do emergency communication strategies with your community during emergencies? We break all those components down and say, all right, now we want you to format it in a way that not just you, but the other people in your network, if they pick up this plan, they understand how it works and what their role is in it. So while I get to do that work, I get to meet even more amazing organizations and networks throughout the city. And so one that I want to highlight that links back to this extreme heat, because extreme heat is one of the deadliest natural weather related deaths that we have within our city, and I think throughout the nation, but you all are more experts in that. But in us knowing that the Department of Health, as well as our Mayor's Office of Climate Justice and Resilience, and a couple of other entities several years ago, they said, let's try this Be a Buddy program. Let's create a couple of steps where we're able to compensate some locally based organizations and the highest risks, where the social vulnerable index is through the roofs, where when we overlap the heat index on top of that map as well, we see that this population of folks are at high risk. Oh my goodness. What do you know? They happen to be Black and Latino as well. So let's make sure that we have culturally appropriate information as well as language. So what we do is we meet our partners where they are. We don't try to say, you have to do it this way. We have a conversation with them, and we draw out their strengths and build on top of those strengths. So one organization that I would love to highlight with you all is The Point. They're called The Point CDC. They're located in Hunts Point, Bronx, which is also within the poorest congressional district in the nation. The Point, their bread and butter is youth development. However, they have a lot of intergenerational components because they do a little bit of program with older adults and a little bit of programs with the younger children. So they're being all inclusive, but their bread and butter, where they do just the most phenomenal work, is around developing youth and getting them involved in various components. So with the Be a Buddy program, it goes to like, hey, check on your neighbor, but also we're going to host a cooling center right here. Our center where you could walk to a block and a half away. When it's extreme heat outside, we're going to have some ice cold water for you, some snacks, some activities, and we're going to make sure that the AC is blasting so you can cool off. Now, as a city, we provide cooling centers. Our data shows that not a lot of people, probably less than 10% of our city, are actually going to the cooling centers. So as we're blasting this out, we host our own extreme heat preparedness workshops, and we host them for the citywide. We'll say, okay, we're doing a 2-part series, any and everybody's welcome. But then what happens is my partners in Harlem say, hey, we need you to come and do it for these groups who didn't make it to your presentation, and we need you to address this component. Hey, Moriah, we need you to come to South Bronx, and we want you to do the same thing. We want you to do it in 15 minutes instead of 45 minutes, and we need to address this component related to our community. So we are making sure that we're adapting our information and our approach according to what the community needs are and according to what they are communicating they want and need from us. The work that we're doing is not easy. The work that we're doing is not a mystery. The work that we're doing is something that's needed. It's bridging that gap between government and community. So many local places. I speak to folks in New Orleans. I spoke to folks in Baltimore, Virginia. They're like, hey, you're doing great work, but we only have one staff for our whole county. And I'm like, well, how many people are in your county? Like, oh, 900,000 people, and there's only one person doing community outreach. Our ratio is pretty small as well. Like, I have 4 people on my team, counting myself, and we have 8.2 million people in New York City. So we are small and mighty, but what we do is we go to where people call on us, but we try to also make sure that we're visible. And we're visible when we're using the vehicles, when we're going out to the Bronx Zoo. Okay, let's go to the Bronx Zoo. Let's catch some people there. Let's go to this local park and catch a couple of passerbyers here. Okay, let's go to this big event, the Nights Out event that happens the second Tuesday or the first Tuesday every August. That's an anti-violence movement throughout the city. We make sure that we're visible so that as folks are, having fun, hey, what do you do for the city? It's like, we're here to help you prepare for emergencies. So I don't know. I think I have about 5 to 7 more minutes. I do want to do a screen share. And I do want to speak on the actionable pieces that you can take, in addition to what Dr. Henderson has said. If you can click the link, the Be a Buddy program, and you'll see how they have it. They have folks register. So people are registering and saying, like, I want to opt into this aspect. And then they do a call down, an old school call down, because these are individuals who may not have the smartphones, who may still have a landline, and who are refusing to leave their homes, because I've always used a fan. I've never used air condition. And we're saying, hey, air condition saves lives. You're not on the island anymore. You're on the New York City island, and you need to use the air condition. And so we're meeting them where they are. When we host our webinars, we're also bringing other subject matter experts. So sometimes when we have a doctor available, we'll bring that doctor in to share what the health risks are. So when folks hear it from that expert voice of the medical doctor, they receive it in their spirit, in their mind, and in their soul of, okay, this is serious. Okay, they're not part of the agency. Like, I got to make sure I pay attention to this. So we're trying to be inclusive. We also make sure that we incorporate the folks like the Point, Holly Mercy Network. We incorporate them into our webinars to share best practices with other organizations for them to know, like, this is not just us, the city talking and saying, here's some things you can do, for them to hear, like, hey, we did this, by the way. Just last Saturday, Holly Mercy Network hosted an emergency preparedness climate change forum, and they streamed it live on YouTube. And they just went at it. They brought some experts in from the climate change lens. They brought me in from the emergency preparedness lens. And they connected the dots of like, hey, we want you to be ready so you don't have to get ready. And so it's like, hey, we don't want to scare you. We want to prepare you. So really, it's creating a culture around preparedness. And I think that's the piece that's missing. When you're impacted by a major emergency, it shifts you to, I got to prioritize this. So there are pockets of communities where they're like, oh yeah, I have my go bag. Like today in Coney Island, oh yeah, I have my go bag. I know what that is, because when Sandy hit, we weren't ready. So now we're ready. When is coastal storm season? Oh yeah, it's now until November 30th. Yeah, we know that as well. So we speak to them, we show them what the newest maps are in terms of the hurricane evacuation zones. We make sure they know where they're located. We make sure they know how to utilize the city resources, but we also strive to connect them to the community resources as well. So many community partners are rising and shining in such beautiful ways. And for us, we want to get information to them to help amplify it for us, but we also want to amplify the great work that they're doing as well. And we also want to compensate them when they're helping us. And so we're going to be able to take it a step further very soon, where if they're activating and doing canvassing because, hey, we think some of the basement apartments might flood like Hurricane Ida last year, so we need you to evacuate and go somewhere safe, we can compensate them for that. So we have city approved funding for that. We started off with 9 networks and getting some federal funding, and then we got approval after approval. I came here, $30,000 budget. Then they're like, you got 1.9 million now, Moriah, because of that program we started. Oh, you got 4.1 million for the program for next year. Can you onboard 20 additional networks to this process? And so as we're working with the partners and we're asking them and providing them structure to create a formal emergency plan, we're also saying we want you to socialize this plan with your other member organizations. We want you to socialize this with your community. We want you to bring us in so we can help do the individual preparedness workshops to really get folks on fire, where it's not a second thought. It's like, let me grab my go bag. Even the children, we have a ready girl. So she has a comic book with the Avengers. And so we're like, hey, let's do that. With our 3 steps, we say make a plan, gather supplies, and stay informed. That's for individual preparedness. I was doing research on some of you, but I didn't have time to look up all of your locations. But many of you, your local emergency management organization has some very basic information on a generic website, and they list those 3 steps very similar to ready.gov, and they just amplify that. And so when we think about action steps of what can we do? What can we do to make sure that we're being inclusive to the vulnerable communities, to the people who are being impacted and hit the hardest? It's going to the communities. Yesterday I was on a call with a pastor who was located in a different part of the Bronx, and another one who was located in a further part. And they're talking about how can we create a coalition and how can you help us with this process? And we're like, well, we can't help you establish a coalition, but we can provide you with some emergency preparedness trainings, capacity buildings, and support as you build out your network. So there's folks who think of these things, they're acting on these things, but to know that these emergencies will continue to happen. It's not if, but it's when. And again, it's a culture of we're not here to scare you, we're here to prepare you. As we go into each diverse community, the reactions are different. So we meet people where they are. We also try to remind our colleagues who don't look like me and don't look like you, hey, these are people that we're dealing with. It's not just a neighborhood that's listed on the plan. Like, you got to humanize it. So we try our best to make sure that we're humanizing who we're establishing partners with, and we're humanizing who we're here for. We're here to serve the greater New York City. We're here to serve all people in all 5 boroughs. So what does that look and feel like? So if a community partner says, hey, I want this training, but I need it translated or interpreted into Spanish and Chinese at the same time, okay, we pay for it. We're going to take care of that, because that's how we are leveling out the playing field, and how we're making sure that we're providing that need accordingly. They may say like, hey, we're having this potluck to celebrate our end of the year programming, but can you come by just to say hello? We go and we stay. We don't say, well, we have to be on the agenda to come. So I say this to say, I imagine for some of you, you're going to wonder who are the emergency managers in your county and or city. Action steps will be to reach out and see who the community engagement lead is for the emergency management. Oftentimes folks cross over from fire department or police department or military, and they become emergency managers, and they don't have a lens for community. And I know it sounds silly, but it's like there's just a blank there. They go blank. So reaching out and offering up yourself as a resource of like, I would love for us to do a heat preparedness webinar where we can share the risk of emergencies, but also promote what we are doing in terms of cooling centers, because every urban city has a cooling center. And county levels, I think they do something different, but similar concept. Public libraries, public schools, community centers, older adult centers, all these different components are resources. How is your county that you live in and serve in utilizing these resources? How is the city that you're serving utilizing these resources? So find the community engagement or external affairs person in your emergency management county/city. The other piece that you can do on your own is you can look up CERT. That's CERT. That's Community Emergency Response Team. CERT is something that is national, and almost every state has a CERT team. They receive training from the local emergency management agency, and they help respond to emergencies, not as first responders, but as supplemental support after the first responders have assessed what's going on. So CERT is going to be an actionable item. And then the other link I think I might have will drop in there. If not, I'll drop it in now, is around the national VOADs, Volunteer Organizations Active in Disasters. You want to make sure that you know what organizations are trained and equipped, or that's their pure vision. So when Dr. Henderson was speaking, they are also a COAD. They're a community organization active in disaster. Their pure vision and mission is linked to, when emergencies happen, we're going to rise and shine, and here's how we're going to do it. When the emergencies aren't happening, you do the preparedness piece. You bring in that professional in to share it, or you tap into your FEMA person, whichever FEMA region you're in, and they want to do trainings with you as well. So I think I'll stop there. I think my time is up.
Thank you. Yeah, thank you, Moriah, for your presentation. I think what you've shared is, in terms of emergency response, can serve as a model for others to implement. So we do have some questions in the chat. And also from the audience. I want to remind you that you can type your questions into the chat box. We'll get to as many as we can, and we ask that you also take a moment to fill out the webinar survey. The link is now in the chat as well. And then Jordan, I'm going to ask you, what questions do we have for Armen and for Moriah?
Thanks, Dr. Curry. And thank you both, Dr. Henderson and Moriah, for your presentations. Dr. Henderson, I want to start with you. This first question that we have is really, how do you use technology in your disaster response? Is that a component that you've incorporated, or do you see an increased role of technology in this space when working with communities that have historically been impacted and listed as vulnerable?
So our main concern during disasters is normally communication. A lot of the individuals that we end up seeing in the clinic or on the street team, mobile crisis, and the other program that we run year round, particularly dealing with those that are unsheltered or dealing with those that are low income, is that people don't have access to phones and people don't have access to internet. So we actually work with a local affiliate of Microsoft that helps us expand, to give people text messaging a capability through cells, and so that we don't have to use like services or Wi-Fi and things of that nature. We also use like two-way walkie-talkies and things of that nature. But in terms of like Wi-Fi itself, we work with an organization called ITDRC, and they provide disaster technology to international organizations during disaster. So I think right now they're in Ukraine. But when a hurricane hits, or if a hurricane is to touch down in Miami-Dade County, they would be our technology like associate. So we don't normally have to like we don't have to recreate the wheel. They come in and help us out. The same is true of like our supplies and things of that nature. We get it from AmeriCares, which is another international affiliate of disaster relief. And we have a number of other partners that we worked with to bring about any sort of technological needs or supplies or, law or social work. But the majority of the work that we do is on the ground. It's hands-on. It's identifying individuals in the community because we do see a lot of technology breakdowns during disasters. So it's really knocking on doors, shaking hands, face-to-face, things of that nature. Oh, and we also use like Google to create like maps and things of that nature. We use Google Maps to create like this whole spatial map of where, for example, the COVID-19 testing sites were available before the government allowed us to know where they were, what shelters were available. We do the same thing using Google, but the spatial maps are more so for us to use because we know it's limited for the individuals that are in the community.
Thank you, Dr. Henderson. And Moriah, coming to you with a two-part question. First, how successful are apps like Notify NYC in reaching low-income communities? And similarly, how have you been able to reach housing insecure individuals and families in the midst of disaster?
So as it pertains to Notify NYC, we just hit the 1 million mark, I think last month, the month of May. So we're 1/8 there. It's an opt-in. And what we do is we are going to the communities, we're going to parent meetings, we're going to open houses for schools, and we bring out the iPads or the Surfaces, and we do on-the-spot registration to ensure that whoever it is that we're enrolling and publicizing to, like, we need you to get Notify NYC, that they get it right there on the spot. We also keep trying to push the citywide community or customer service number, which is 311. And we say, like, by calling 311, if you live in New York City, you go to this customer service line and you can say, hey, I want to enroll for Notify NYC. We know that the deeper you get in technology where you don't have that face-to-face interaction, it turns off people. So we strive to go to those parent meetings. We'll bring out the iPads. We'll do our presentation steps 1, 2, 3, and then we'll have our public notifiers on the spot to kind of communicate what this Notify NYC app is. This is an opt-in. Here's how you use it, and now make sure other people are using it as well. And with regards to folks who are in transitional housing, homeless, or just transient, we strive to work with the Department of Homeless Services, and we do have a partnership with the Department of Homeless Services, a unit that works with schools, specifically the community schools, and we incorporate ourselves within those summits that they have with the different social workers to let them know what the resources are available. The reality is when there is a mandated evacuation, then we're going to be providing that temporary housing. We're going to provide that evacuation shelter center, and we're going to communicate where it's at. If we don't do that, behind the scenes, we're quietly blocking off a large quantity of hotel rooms. And so if folks call and they're like, hey, I have someone and they're in a wheelchair and I need to evacuate, I'm in this area, we're able to, by calling 311, we're able to connect them to get private transportation and go directly to that mysterious hotel that's very clean and safe. But that is a gap that we have in the New York City, period, is around how to serve folks who have insecure housing and or are transient and or are homeless.
Thank you, Moriah. And I want to open this last question up to the both of you. I now pass it back to Dr. Curry shortly after that, as we're running out of time. But the question that I had for you both is, in your experiences, what has been the most important lesson and or experience for you in doing this disaster work?
I guess I'll go first. I think that one of the most important things that I've learned is that the people closest to the pain, to the harm, are the people who also have the solutions to the problems that they find themselves in. As I mentioned, people asked for the disaster relief team, and we created it. A lot of the programs that we end up creating, the Sobering Center, the free urgent care, the street medicine team, were all as a result of people who were surveyed in the community and said, this is something that we need. The other thing is that in times of disaster, I think the most important people that we can rely on are people that look like us, that people we can trust, people we've seen before. And that's very important historically. And lessons that I know is that, you can call on your neighbor to help you out in a time of need. And that's usually who is probably most likely to help you. And we try to emphasize that and train people within that realm. And I think we're successful in doing that as well.
For me, the greatest surprises have been, instead of where's Waldo, where are we in the work of emergency management, preparedness, response, and recovery? It's so important to have representation. It's so important for you to be from the local community that you're also serving. And so often that's not the case throughout city to city, county to county. For the counties, usually where people live, they also work. For cities, it's not always the case. And I get ecstatic when I get to be in the community, because for our community members who are leaders, it's like if they see a need, they feel a need, and they know to connect to us and say like, hey, we've done all of this. Are you able to figure out something for this? And we're like, well, we can't, but we'll connect you to the next agency who can.
And I know this discussion can go on so much longer, but we do need to wrap up this session. So I really want to thank both of our speakers, as well as thanking all of you who are participating in the webinar series. I hope that you found this information useful as we all did. As a reminder, these webinars are held on the second Friday of the month. The next webinar is scheduled for July 8th, and the topic is land use. Before you leave, we ask you to take a moment to complete the webinar survey if you haven't already. For this webinar was made possible with funding from Johnson & Johnson, the Energy Foundation, and the American College of Physicians. This really does now conclude our session, so we want to wish you a good day and a good weekend, and thank you again for your participation and for our speakers. Thank you.